Pregnancy can be such an amazing time in your life, and yet it also can be a stressful time in your life, both physically and otherwise. And I want to share with you a little bit of information so that you can start to think about some things even before you decide you want to start your family. And that is, we want to create an environment in the female who's going to carry that child to be extremely healthy. We want to make sure that nutrient levels are appropriate, that hormone levels are absolutely perfect, that the gut is clear and very healthy and the immune system is working. Why? Because that's the environment that the child is going to live in for a very long period of time before it takes its very first breath. And it's important that the mother is healthy. There's been research studies now that show that we are born, unfortunately, with the possibility of over 250 chemicals that pass through cord blood. So the more work we can do on that female who's going to carry the child before they actually conceive, the better the result will be, where we can pass less to the child. Sometimes it's even as simple as some toxic metals that we carry in our bodies as women because of previous exposure that can also affect the child. And there's so many different ways to look at the body through testing to make sure that those levels are perfect. Now we've conceived. We need to make sure that that baby is getting the proper food, right? The proper nutrients. So we still have to take care of ourselves to make sure those levels are good and that we're eating adequately and substituting in supplements if needed if we're truly deficient. We're also changing our bodies. So as a result of the growth of that child, we're trying to make space in the abdomen and in the pelvis for that child. And then it gets closer to time to deliver. And for the female, we're going to see changes in the pelvis that can also affect us, that can cause discomfort or pain, such as low back pain, pelvic pain, hip pain, radiating pain, numbness and tingling down the legs or into the feet. So it's really important both prior and during that chiropractically we look at the pelvis and the spine to make sure we get you as comfortable as can be. So if you've had any of that discomfort or symptoms prior to the pregnancy, chances are really good it can get exacerbated once you're carrying that child. When you get closer to full term, the pelvis actually needs to change and expand, allowing for that baby to pass through. Because think about it, ladies, you can see what size you are and you know the size of a typical child. Doesn't really make sense how they can pass through comfortably. So as a result of a lot of changes, one of them is that the pelvis will actually expand. That can put pressure and change the way your body is used to functioning. Chiropractic care can help with that tremendously. A, to help you with the pain you may have previously had, or B, allow you to adjust to those changes as you're carrying that child, the child is growing, and even to ease delivery, which we all know we want to go smoothly. And even after the fact, once we've given birth to that new beautiful baby boy or baby girl, the pelvis has gone through some changes where we still can have a lot of pain both in the back, hips, and legs as a result. So please consider chiropractic care. Please consider prenatal care. Take a look at how the body is currently. Let's create the most healthy environment that we can for the healthy baby.